Good afternoon, class. Welcome to week 7 of Nursing 301. This week we're going to cover chapter 72, Care of the Infant, Toddler, or Preschooler. We're going to start off with communicable diseases. What is communicable diseases? It's an infection or disease transmitted from one person to another, many of which are preventable, but can be problematic due to the infectious incubation period. And because usually the infectious period is usually before symptoms appear. The incubation period is a period between exposure and the development of symptoms, and transmission-based precaution are used when treating individuals who have highly contagious conditions. Transmission-based precautions supplement standard precautions when suspecting or caring for individuals with specific infectious diseases. Infectious diseases can be spread by one or more of the 3 primary methods: contact precautions, droplet, or airborne. They can have direct contact. That is one of the ways, direct contact with the infectious agent. You would use contact precautions. Moisture droplets that connect with humans through close respiratory or mucous membrane contact, you would use droplet precautions. And for respiratory routes that transmit infectious microorganisms through longer distances suspended in the air, you would use airborne precautions. So those are the the 3 types of, we have contact precautions, droplet precautions, and airborne precautions. So, conditions that create unnecessary spread of preventable diseases include lack of immunization, not completing the series of immunizations, or the waning of the original strength of the immunizations. So, starting with recommended childhood immunizations. Of course, our long-term goal of immunizations is to eradicate a communicable disease. The short-term purpose is to prevent an individual from contracting the disease from one person and passing it to another. Hepatitis B is typically the first immunization received by a newborn. It is spread by contact with the hepatitis B virus found in infectious blood, semen, sexually related body fluids, contaminated needles, and transmission from infected mother to newborn. Treatment is symptomatic. Prevention via vaccination is recommended for all infants and non-vaccinated children, adolescents, and adults. Most generally, that healthcare workers are provided with the Hep B immunization as part of their employment protocols. And then we have rotavirus. That is a virus that causes severe form of gastroenteritis in infants and young children. Adults can be infected, but their symptoms are a lot less severe than those in children. It's spread via the fecal-oral route, contaminated food or water, contact with contaminated surfaces, or occasionally via the respiratory tract. Incubation period is about 2 days, and treatment is symptomatic. And then we have our diphtheria, tetanus, and pertussis. Diphtheria is transmitted through droplets, and it begins with a sore throat, fever, and often generalized aching malaise. The causative bacillus produces a poison that can weaken the child's cardiac muscle. People who show no symptoms of diphtheria may be carriers and are treated prophylactically with antibiotics. Tetanus is also known as lockjaw. Tetanus is not passed from one person to another. Rather, an anaerobic bacteria enter through breaks in the skin. especially if it's a deep puncture wound. Early symptoms include the inability to open or close the jaw, difficulty in swallowing, and stiffness in the neck and abdomen. It is preventable through the administration of scheduled series of immunizations using tetanus toxoid, which is often combined with diphtheria or the pertussis, acellular pertussis, such as a DTaP or Tdap, or DT or TD. Booster immunizations are necessary even in adults because the immunization against tetanus is known to wane over time. And then pertussis. Pertussis is also known as whooping cough. It is highly contagious bacterial respiratory disease. It's most common in young children who have not been immunized. The causative agent is Bordetella pertussis. It's transmitted through direct contact and through droplets. Pertussis can be prevented through diphtheria, tetanus, acellular pertussis, the DTaP immunization. And then booster immunizations for adolescents or adult given the combination, the Tdap. So they get the DTaP when they're younger and Tdap when they get a little older. Then we have, like I say, with the incubation period for pertussis is 5 to 21 days. But they'll get a cough that steadily worsens and leads to spasms, and it is characterized by a whooping sound. So, like I said, that is highly, highly contagious. So the summary of the diphtheria, tetanus, and pertussis vaccine, like I said, there's DTaP, Tdap, DT, and TD. Two of these, the DTaP and the DT, are given to children younger than 7, and the Tdap and TD are given to older children and adults. And then we have our influenza type B. That is a bacterial infection. Consequences can be death or morbidity. It can cause permanent hearing loss, brain damage, it is spread by direct contact, and we treat it symptomatically. The initial symptoms of it are maybe flu-like, but the symptoms can become severe really quick. They can have febrile seizures, and we want to observe their respiratory function. Then we have our pneumococcal infection, which is a bacterial infection, which causes pneumonia. It may be preventable when the client is injected with one of the available forms of the pneumococcal vaccine, but that is another immunization. And then we have our inactivated poliovirus. It's the only vaccine used in the United States since 2000. Because polio does attack the CNS, we treat it symptomatically with emphasis on respiratory function and long-term physical therapy. But there are two types of vaccine that exist. They have the inactivated polio vaccine, and that is the only one that has been used in the United States since 2000, like I said earlier. And the oral polio vaccine is still used, in many different parts of the globe. And then we also have our influenza, or the flu is a general term for seasonal viruses or specific endemic viruses. The flu is different from what we often refer to as the cold or the common cold. Treatment for the flu is symptomatic for fever and vomiting. Antiviral or antibiotic medications are used for some individuals. There are no vaccines yet available against what is considered the common cold. Then we have measles, also known as rubeola, also known as the red measles, the 10-day measles, or measles. The measles virus is found in the nose, mouth, throat, eyes, and their discharges. It is transmitted through direct contact with an affected individual and through airborne droplets. Measles is highly communicable and difficult to recognize in early stages because sometimes it resembles the common cold or roseola and rubella. The incubation period is anywhere from 10 to 20 days, and it begins with a slight temperature, runny nose, and watery eyes. Then they'll get diagnostic bluish white pinpoint spots with a red rim called Koplik spots that appear in a person's mouth. And then, of course, like I said, it is spread by through direct contact with an affected individual and through airborne droplets. Measles is most hazardous to the very young child because the infection can spread to the middle ear, causing otitis media. Measles can also cause pneumonia, encephalitis, and it can lead to permanent brain damage, learning disabilities, or death can result as a result of measles encephalitis. Measles outbreaks, they occur periodically in populations in which large groups of individuals have not received their necessary immunizations. And then the mumps. Mumps are also called epidemic paratitis. It is a viral disease that affects the salivary glands, especially the parotids, and it's transmitted through direct and indirect contact and through salivary secretions. Close contact is required for mumps to be transmitted. The incubation period is 2 to 3 weeks. The first sign is usually a swelling of the parotid gland on one side or both. Treatment of the symptoms is symptomatic. And then we have rubella. Rubella is also called the German measles or 3-day measles. It is a viral infection that's mild and lasts only a short time. However, rubella can cause serious fetal malformations if a pregnant woman contracts the disease. Congenital rubella syndrome, or CRS, occurs in about 90% of infants exposed to rubella. It is transmitted through direct contact or airborne transmission. All children should be immunized. And then we move on to our varicella, which is chickenpox. It originates with the varicella zoster virus, which is the same virus that causes herpes zoster shingles found in adults who had chickenpox in earlier years. So, with varicella, we treat it symptomatically. First, children, they will get like an itchy rash, and then it moves to papules, and then vesicles, and then pustules, and then crust-like lesions. The most common complication of chickenpox is infection caused by scratching the blisters, which can leave scars or pock marks. Benadryl and other anti-itching measures, such as antipyretic medications in the bath, may relieve intense itching. But with the varicella, or the chickenpox, I want you to remember the first eruption seen is the papules. And then it lists here in the book, it goes to hepatitis A, which is up with the Hep B on the top of this slide. And Hep B it belongs to a list of disorders causing inflammation of the liver. But unlike other forms of viral hepatitis, it doesn't lead to long-term infection. And then we also have our meningococcal, which meningitis, it is an inflammation of the membranes that cover the brain and the spinal cord. It can be either bacterial or viral. That can leave the individual with brain damage, hearing loss, and learning disabilities. The Neisseria meningitis and Streptococcus pneumonia are bacterial forms of meningitis for which there is specific vaccines. So as nurses, we want to teach the family caregivers the importance of immunizations. And what we have to be aware is preventable diseases may still occur in susceptible individuals. So contagious diseases, we have RSV, or respiratory yeah, I can say that was syncytial virus, or RSV. That is so much easier to say. It's a very common seasonal virus that affects the upper respiratory tract, lungs, and bronchioles. It's transmitted by direct or indirect contact. It can be transmitted through tears, nasal or oral secretions. Sneezing spreads airborne. Peak season is fall to spring. Is typically present with symptoms similar to the cold, and we're going to treat it based on the symptoms. Streptococcal infections. Common in children greater than 2 years of age. It is spread by direct contact. Streptococcal sore throats. Common in children greater than 2 years of age. We're going to treat with antibiotics. They may complain of a lump in the throat and feel sick all over. The most serious complication is rheumatic fever, rheumatic heart disease, and nephritis. Prognosis is good if it's treated properly. So with streptococcal sore throat, they may complain of a lump in the throat and feel sick all over. Scarlet fever, also referred to as scarlatina, is it is another type of strep infection. Symptoms developed after an incubation period of 1 to 7 days. They include a generalized flush or redness caused by the sandpaper-like rash of pinpoint-like red spots. So their tongue is coated with a white substance which disappears, leaving prominent papillae or strawberry tongue. Complications can be ear infections, nephritis, arthritis, cardiac problems, and pneumonia, and they treat with bed rest and antibiotics. Rheumatic fever is an autoimmune response to GABHS. It belongs to a group of diseases called collagen diseases, or it caught by yeah, I can talk today. Collagen diseases, or it affects the connective tissue. It's believed to result from continued streptococcal infections. Prompt treatment of the streptococcal infections greatly reduces the risk of contracting rheumatic fever. Complications of rheumatic fever include rheumatic heart disease. Most significant symptom of rheumatic fever is polyarthritis, which can last days to weeks, but it does not cause joint deformities. And usually after the attack, the joints will return back to normal. The diagnostic test that they can run to indicate rheumatic fever, elevated white blood count. They will have an elevated ESR, a positive C-reactive protein, and an elevated ASO. I want you guys to remember, this is on page 1196. Diagnostic tests with the following results may indicate rheumatic fever, and not all findings need to be present. They can have an elevated WBC, an elevated ESR, a positive CRP, and an elevated ASO. The key to rheumatic fever is to prevent permanent heart damage, because it can impair the mitral valves, and the degree of carditis that directly affects recovery rate can be fatal. Roseola is a benign disease of infancy. They'll have a high fever followed by a rash, is viral, and one attack seems to confer lifelong immunity. You know, what do we want to consider as nurses for each of these? Provide education on transmission-based precautions, and we want to also provide pain relief and regulate any of their activities. But most of all, we want to provide education to the family caregivers on transmission-based precaution and pain relief. Parasitic infections. Parasites live in or on the body of another living organism. Skin parasites can spread easily. Common parasites are bacterial, protozoa, fungi, insects, and worms. GI tract, roundworms. Hookworm infection is a parasitic infection caused by blood-sucking roundworms. They're found in the ground and on hygienic areas. They survive in the small intestines of a human, dog, cat, or bird. Giardias can affect all ages. It's a common cause of diarrhea, spread through infected feces or drinking contaminated water. Breeding sites are swimming pools or recreational waters. Cryptosporidiosis. Cryptosporidiosis can affect all ages, including infants, children, and adults. Those Giardias and cryptosporidiosis are parasites. Toxoplasmosis is caused by infected cat or dog feces from cat litter or ground soil. Pediculosis, is most common. That is lice. They can treat with Lindane or Quell, Purinol, Rid. They usually need to treat at least twice. And then also they can have pediculosis pubis, which is lice in the pubic area. With this, bedding and clothing usually generally are also infested, so everything needs to be washed and that has been in direct contact with the infested person. And children are most vulnerable, as are the homeless and transient individuals. And scabies. Scabies is a microscopic mite that is easily transmitted among children and adults of all socioeconomic classes. The mite burrows itself into the epidermis, where it lives and lays egg. Direct skin-to-skin contact spreads the mite from one person to another. High-risk places for infection include child care centers, long-term care facilities, and prisons. Pinworms, most common in children, because they're always putting their fingers in their mouth. Children ingest eggs, and the eggs mature in the cecum. Hatched worms lay ova in the anal and perineal area and it causes itching. Signs of pinworms can be teeth grinding, fatigue, anorexia, and irritability. And they will treat with anthelmintics, and they will treat all family members. So obtaining a stool specimen for pinworms is located on page 1196, and they suggest that you put a piece of clear cellophane tape on a tongue blade and wipe the tape around the end of the tongue blade with the sticky side out, and then spread the child's buttocks and press the tape against the child's anus, and then transfer that tape to a clear microscope slide and send it off to the lab for examination for eggs. Nursing considerations for parasitic care. Teach good personal hygiene. Treat all family members simultaneously. Teach client or caretaker to avoid food preparation during treatment. Discuss careful washing and cleaning of all household items and clothing when teaching about treating for lice. Avoid inhaling the fumes of lindane or quell. Avoid applying parasitic lotions to open lesions, a rash, the face, eyes, mucous membranes, or urethral meatus, and observe and monitor for side effects. Trauma. Susceptible to injury from accidents, falling, choking, drowning, poisoning, burns. Little ones are susceptible from a lot of different types of accidents or injuries. Fractures are your most common. Most common are the radius, ulna, clavicle, tibia, and femur. Nursing considerations. If they're in a cast or traction, check their circulation, observe skin color, sensitivity, temperature, motion, and pulse distal to the injury. Lacerations, cuts, and punctures. Crushing injuries, fingers caught in car doors, caught under heavy pieces of furniture, hit by moving vehicles, electric car windows, garage doors. We want to educate regarding monitoring wounds for signs of infection and if they need a tetanus booster. Because sometimes they might need that tetanus booster again. Foreign objects. Children will try to put into any convenient body opening. Beans up the nose, beans in the ear. We may assist in removing objects, but we need to educate the caregivers to keep small objects out of reach. And then animal bites and scratches. Animal bites and scratches can be serious because they may require plastic or reconstructive surgery. And, as nurses, we want to provide education to the caregivers to cleanse the scratches, apply the antibiotic ointment, watch for signs of infection. Remind or ask if there is a tetanus booster if it's needed, prophylactic rabies injections if the animal becomes ill or can't be found. So, always remind children, especially if it's not your own animal, remind them, even when they're little, not to put their face down in front of an animal's face, because you never know what they're going to do, especially if they're not used to little children. Trauma, burns, partial thickness or full thickness. Of course, the extent of burns is determined on a percentage basis. The chief nursing concerns is combating shock, alleviating pain, restoring fluid and electrolyte balance, preventing secondary interventions, prevent infections and contractures, reconstruction, repair of damage. Treatment of burns can be long-term. Poisoning. Plumbism. Plumbism is lead poisoning. More than 80% of poisonings occur in the home. Cleaning compounds are a major problem. There has been decrease in accidental poisoning since drug companies began installing safety caps on bottles. There are poisonous houseplants. You want to call poison control. You want to post a local poison control number on all telephones. One way to prevent it is keep all medicines, cleaning supplies up and away from the children's reach. Nurses, we need to observe for any changes in LOC, dizziness, nausea, vomiting, unusual behavior, extreme drowsiness, or excitement. So, with poisoning, though, how do we determine if a child is going to be hospitalized due to a poisoning? So, if several hours have passed since the child ingested the toxin, the stomach lavage is usually not performed because most of the substance is already absorbed. So a child is admitted if after lavage, poison has been absorbed into the bloodstream. So if too much time has passed, they will admit them because the poison has already been absorbed into the bloodstream. And then sudden unexpected infant death and sudden infant death syndrome. SIDS, sudden infant death syndrome. Etiology is unknown, but there's one theory where there's an abnormality in the brainstem functioning, which results in faulty respirations, sleeping in a prone position, incomplete burping after feeding, secondhand smoke, and use of pillows. Cause of sudden unexpected infant death. Some theory states metabolic disorders, poisonings, hypothermia, neglect, abuse, and accidental suffocation or unknown. Diagnosis of SUID or SIDS can be made only following a thorough autopsy, forensic evaluation of the scene of death, and a review of the child's clinical history. How can you prevent it? Put them on their back to sleep and have an apnea monitor. Child abuse. It is a widespread social problem. The thing of it is with child abuse, the definitions of child abuse and neglect vary according to state or federal legislation. Most abuse is by either commission or omission, is caused by a caregiver. Neglect is more often considered an act of omission. We are, as nurses, mandatory reporters. If we suspect abuse or neglect, we are obligated by law to report it to your supervisor, a healthcare provider, or the police authorities. Being aware of the signs and symptoms of child abuse begins by knowing the normal growth and developmental milestones. Because signs and symptoms of child abuse or neglect may not always be clearly recognizable. So you want to gather your data. You need to remain objective. Guidelines for reporting abuse. Like I said, it is mandated. You want to believe what the child tells you, observe the child's reactions, document observations, and teach the child. So when you document, you want your documentation to be objective. You want to identify and document every observation to the last detail. You want to measure bruises, abrasions, or any other signs of injuries, and you want to take photographs. So, sometimes a sudden change in behavior of a child of any age is a clue that Something in that child's life might be causing a problem. An abuse may be recognized by anger, silence, acting out, depression, or other changes in their behavior. Anger is likely to be your first response to any type of child abuse. But like I say, we have to take the time, we have to be objective. So on page 1202 is tables, it's box 72-1. It talks about data gathering and nursing detecting child abuse. You might just want to read through that. So neglect. What is emotional neglect? Is a child deprived of love, affection, and attention from family caregivers, or continually berated, called derogatory names, or told they are stupid. Physical neglect. The child does not receive adequate food, water, clothing, or medical care. Physical abuse. The child has been physically harmed and injury has occurred. Standardized definitions of abuse are not yet available. Injury is inflicted intentionally. They have unexplained bruises in various stages of healing, and they have unexplained fractures. Emotional abuse is often difficult to document with certainty. We may notice frequent verbal comments that result in loss or destruction of the child's self-esteem, most often combined with varying degrees of physical neglect or abuse. Sexual abuse ranges from exposure and fondling to intercourse. Abuser may be a stranger, someone the child knows well, or it may be a family member. It's difficult to identify and harder to prove. They will usually have sudden behavior changes, emotional disturbances, abdominal pain, gastric distress or headaches, avoidance of touching or physical contact, or vaginal or rectal bleeding or lesions. You know, what is our roles as nurses? We have to report it. We are mandatory reporters. You know, schools have programs that teach children about sexual abuse and incest, and they also have programs all the way down into the kindergarten age that teach about good touch, bad touch. Failure to thrive. This is on page 1205. It is inadequate physical growth, maybe only weight, or it could be weight and height. They have a flat affect, little to no emotional expression in response to external stimulation. More commonly, failure to thrive has a psychosocial rather than a congenital physical cause. That is on page 1205, second paragraph, second sentence. Failure to thrive has a psychosocial rather than a congenital physical cause. So failure to thrive has a psychosocial rather than a congenital physical cause. Danger signs of failure to thrive are on page 1206 in box 72-2. So sometimes it's an early separation of the mother from the infant, or it could be major depression or mental illness of the prominent caregiver. It could be related to a major family crisis that disrupts normal family interaction. But what we have to consider as nurses is that they may be passive and withdrawn and have developmental delays, and families of failure to thrive children may not be able to afford food. Is it their inability to afford food, or is it actual abuse or lack of parenting skills? So with the failure to thrive, if they're hospitalized, we need accurate I's and O's and keep them on a feeding schedule. Skin diseases. We have the nevus. We have lymphangiomas. So, nevi, which is plural, or nevus, is an abnormal skin mark that can be either hereditary or acquired as a result of tetragens. They can be pigmented or vascular. Some types are called birthmarks. So they do require close observation because they can develop into malignant melanomas. So lymphangiomas is an overgrowth of lymph vessels. Hemangiomas are an overgrowth of blood vessels. You can have a capillary hemangioma, which is a port wine stain. It usually doesn't fade. You can have immature hemangiomas, which is a strawberry mark, which will usually regress and disappear. And then you can have Mongolian spots. Mongolian spots are irregular, dark blue-green areas found on the lower back. They have regular edges. They're almost always present in Asian infants and Mediterranean or African infants. Rashes. Some rashes are of unknown cause. Some are symptoms of an infectious disease. If no disease, treat it symptomatically. Eczema is a severe atopic dermatitis characterized by remission and exacerbations, accompanied by vesicle formation, oozing, crusting, excoriation, itching. It may be related to allergies. Often the cause is unknown. And then we also have eczema herpeticum, which is a dangerous complication. Effective restraint for that is an elbow restraint, and that is eczema complicated by the herpes virus. So sometimes you want to try an elimination diet to see if it's related to allergies, and then infants can also have cradle cap, which is seborrheic dermatitis of the scalp. It often occurs when a caregiver is apprehensive about hurting the infant's soft spot, but we just need to teach them that regular shampooing and brushing of the baby's head is important. Developmental dysplasia. That is where one or both hips may be improperly located in the ball and socket joints. The femur is displaced, or the acetabulum may develop improperly. To treat, they will place in a splint brace or a Pavlik harness for 3 to 6 months. If left untreated, it can cause lordosis later in life. Lordosis is a concave curvature of the lumbar spine and a protruding abdomen. And then, children, if they are in these types, like the harness and that, or the splint brace, we want to handle them carefully and watch for signs of irritation or pressure and turn them often and help them exercise. Tenotomy is a transection of a tendon, and they will treat after traction. And then we have clubfoot or talipes, which may be flexible or rigid and fixed. It occurs more in boys than it does girls. And we just need to educate the caregivers to have patience, as the child may be in a splint or a cast for several years. Torticollis or wry neck may be congenital or acquired by damage to the nerves or muscles. Congenital is caused by the failure of the sternocleidomastoid muscle to lengthen as the child grows, and it must be corrected, or curvature of the upper spine and abnormal elevation of the shoulder will result. So we want to treat with passive active exercises, surgical correction or casting, and examine periodically until after puberty to prevent reoccurrence. Neurological disorders, Reye syndrome or Reye syndrome. It is acute and potentially fatal childhood disease. It causes swelling in the liver and brain. It's rare. The etiology is unknown. It may be associated with an inherited metabolic disorder. They're unable to break down fatty acids due to deficient or absent enzymes. Treatment is supportive. There is no specific diagnostic test. You want to educate caregivers related to the danger of aspirin use with sick children. For meningitis, it is acute inflammation of the meninges of the brain caused by bacteria or virus. Symptoms: fever and neutral rigidity. Vital treatment, we want to, viral treatment, we want to treat symptomatically. If it's bacterial, IV fluids and antibiotics, we're going to put them in isolation times 24 hours after antibiotics. We're going to give prophylactic antibiotics to a healthcare worker if they've been in close contact. Common cause is by the group B streptococci and E. coli. Decreased environmental stimulation and neurological checks are essential. So, it is an acute inflammation of the meninges of the brain, and it can be viral or bacterial. An encephalocele is bones in the fetal skull don't close properly, and a portion of the brain protrudes or herniates through the opening. Degree of damage depends on size and location. The chief danger of an encephalocele is rupture of meningeal sac leads to encephalitis or meningitis. It can be corrected surgically. Then we have spina bifida, the malformation where part of the vertebral or spinal column is open or missing. It may be symptomatic or it may cause paralysis. So spina bifida occulta is an opening in the vertebral column with no apparent symptoms. A small tuft of hair or a port wine stain sometimes appears in the vertebral area. Meningeocele, one layer of the meninges herniates through the opening. The muscle weakness possible. Difficulty with bowel and bladder control. Corrective surgery is needed. And then we have a meningeomyelocele or meningeocele, and that is the most serious form where the meninges or part of the spinal cord protrude throughout an opening, and they're usually paralyzed and surgery is necessary. Children with spina bifida are extremely sensitive to latex, so you really want to be careful as to the types of toys that you give them. So children with spina bifida are extremely sensitive to latex, so you want to be very careful of the types of toys that you give them, such as, hydrocephalus. I went one too far. Results from circulation after being disrupted, and spinal fluid collects, causing head swelling and brain damage. Often results from improper development of the brain or spinal cord defect. It can also be a complication of meningitis, head injury, or cranial hemorrhage. Symptoms and treatment. They will have a progressive increase in head circumference. So they will insert a shunt. A ventricular peritoneal shunt is preferred, and it's inserted as soon as possible after birth, as brain damage is irreversible. And with increasing ICP, you will see increasing irritability, bulging fontanelles, and a change in LOC or in their eyes. Nursing considerations, we want to prevent skin breakdown, precautions to prevent infections, we want to prevent aspiration and pressure sores. Post-op, we want to observe for signs of shock or hemorrhage, and we want to check for spinal fluid leakage. We also want to measure the head circumference at the same site each time using a disposable paper tape. Febrile seizures, generalized convulsions of unknown etiology, more common in males. Risk factors, family or personal history of febrile seizures and neurologic disorders. Treatment, we can use antipyretics, tepid sponge baths. We may also include Ativan or lorazepam or phenobarbital. We want to teach the caregivers early management of fever and seizures at home. And breath holding spells, that's where a child will hold their breath and become unconscious. It may occur following a fall, especially if they hit their head. Sometimes holding their breath is related to tantrums. But if the child must be stimulated to breathe, you want to advise the parents to have the child seen in urgent care or ER. Metabolic and nutritional disorders.